What does dentistry have to do with airway and jaw development? Things that we're looking for in our exams, especially in our children, is how their jaws are developing. So we want to look for spacing between all of their baby teeth. We want to see that they're able to breathe through their nose well, and we also want to make sure that their tongue is not tied down to the floor of their mouth. It's also called a tongue tie. So if we see a child that their arch isn't broad, or we see that there's not spacing, or even worse, if there's crowding between the teeth, we're looking for the reasons why. So the first thing we want to do is look at the nasal breathing. Is the child able to breathe through their nose? If they have an allergy to something, we need to find out what so that we can take care of that. Because if they can't breathe through their nose, the tongue is never going to go to the right position. Try this at home. Pinch your nose and put the tongue up on the roof of your mouth, and then try and breathe. Okay, let's do it. It's impossible, you can't do it. The tongue being on the roof of the mouth is the body's natural expander. It's a strong muscle. It presses out and it presses forward. And when it does that, it grows the jaw. It actually makes the spacing between our teeth, and that's what we want. By doing that, we actually have a larger airway and can breathe better. So we're looking for nasal breathing. We're looking for the tongue to be mobile and to be able to go up to the roof of the mouth. So things that you can look for at home. Look for spaces in between your child's teeth. We want to see spaces between them at that age. See if they breathe through their nose. If they are sitting and reading or playing and you notice that their mouth is always open, like hanging open, that's not normal. We want their lips to be closed and sealed. We want them to breathe through their nose, okay? And also, if they have a hard time saying certain words, and they've been going to speech and they're not making any progress, it could be their tongue. I've had children that couldn't even eat ice cream cones because they couldn't stick their tongue out far enough. And of course they're going to have problems with their speech. So if your child is having any of those issues and you want us to take a look, we would be happy to look at these things for you and see if there's anything we can do to help.